get started, I wanted to, first of all, welcome you. I'm Shelley Reynolds. If I haven't met you, I think I've met everybody in this room. But I wanted to do a warm welcome for Aaron Bishop, who is here with us today, and his organization is making this all possible. But I also know Aaron personally, and I know that his values are very much behind this project, so it is quite an honor that he's here spending the day with us. So with that, I want to turn over to Aaron, who has a few things.
Good morning, everybody.
Good morning.
How are you? It's fun, this being my third year now at the event. I wasn't here at the inaugural one. I had joined, at that point in time, ACF, Administration for Children and Families, and then ACL now at that particular point in time. But it is a pleasure to be here and to really see how the project has advanced. But before I get started, let me ask and see how many, who are the new states in the room? Can you all raise your hand and just shout out what states you are from? I know Maryland's in the house. Pennsylvania. Alabama.
South
Dakota.
Ohio.
Hawaii.
So they represent about half of the new states, so we're excited that they could join us today.
And it's fascinating to see where this has gone, and specifically where it started. Again, how many of you were present at the Wingspread Conference going back to what, 2011, 2012 in Wisconsin? Only two individuals left from that point in time, where at that point in time, Commissioner Sharon Lewis brought individuals together to have a discussion about how can we do a better job at supporting families? How can we look at the data that we have, knowing that 75% of our families aren't connected with this traditional service delivery system? Why we need to do a better job for individuals that are receiving services. What about the families that aren't? What are they facing? How can we look at not only the individuals and the person, but realizing again that these people are being served and supported traditionally by their family and family members. And so therefore we have to take and look at the entire family unit as opposed to focusing on that one individual. And that was the start of the discussion. And not too long after that, this grant came out, in which it was hard to describe. It was hard to wrap your head around and talking about what is this project going to do? What is it going to be about? How are we going to tangibly, which John and Yoshi are trying to do, how are we going to tangibly talk about and develop outcomes? When you're trying not to, at times, focus on a specific policy, or when you're not trying to just look at Medicaid and traditional DD services, but also looking at engagement and interactions and how people are feeling and talking about and interacting with the system and creating a more positive environment for which that can occur. And how do you measure that? So seeing that those are parts of the initial conversation, to states then rolling out trainings and resource guides and packets and information that's being sent to families, to webinars that associations like AUCD and others have helped put on to bring light to this issue, to today, when we have an expansion of, I didn't count how many states that was. Is that 6?
Maybe 11. Well, there's 6 here, but it's 11 new states.
So 11 new states, I didn't realize that. So 11 new states, plus the initial states, and now we're doing things such as connecting with and having joint conferences with the DD directors. We're seeing, and it's something that I'm not supposed to talk about, but I'm going to, we're seeing national publications come out, I'm thinking about the next PCPID report, that really highlight and focus on supporting families. And when that comes out, again, everybody here should take a look at it and read it, because I think you'll be happily surprised at what is in it. But the work that you all have done from the beginning to this point has been truly amazing. But you should also realize that it has not been done in a silo and a vacuum. What we've tried to do with a lot of our funding, with a lot of our priorities, is to look at supporting individuals, supporting families through multiple lenses. All right? So, we need better and stronger self-advocates as part of this. So you've seen AIDD come out with funding specifically related to self-advocacy, including the new announcement that came out a couple of weeks ago that's looking at a national training and technical assistance center when it comes to self-advocacy. We've supported decision-making. And again, how can supported decision-making be used as a tool to help people live and thrive and flourish in the community? And how can we all use supported decision-making to help people grow? We've seen it with our diversity work and trying to figure out, when we're talking about families, we're talking about all families. So we're trying to make sure that we reach out to families of color that traditionally, I could argue, have not been represented by a lot of the organizations that we typically go to. Or some of our new and diverse families, where you're talking about families that have two parents from the same gender. And how we ensure that we're including people into this environment that we're calling family support and supporting families. And those are just a few. We've been spreading our money around, trying to look at this same issue from multiple lenses and bringing more individuals into the fold. So now you hear me traditionally talk about, and I'm actually going to take it down a different path. You're going to hear me talk about, or you typically hear me talk about outcomes. And at the end of the day, we need outcomes, we need outcomes, we need outcomes, because we need to show OMB and we need to show Congress what's happening. That these types of programs, that PNS, etc., needs to continue. However, I'm going to add a different twist this time. We need outcomes for all those various reasons, but for additional reasons as well. Shelley said a few moments ago she believes that I have the proper values, and that could be debated. But most importantly, we have an administration change coming up. And we're going to have new leadership across the board, specifically at HHS, from the secretary all the way down to the assistant secretary / administrator of ACL to my position. Probably another 18 months. And so the reason that we need outcomes now is much closer than OMB and Congress. It's that we're going to have to show, and again, staff at AIDD are going to be responsible for this as well, but show the new commissioner, whoever he or she may be, that continuing to support families is the right way to go. Because at the end of the day, that's the person or those are the individuals that will prove whether or not programs such as this, grants such as this, continue to be funded. So knowing what Shelley asked you all to do and writing down what are your goals, what are your accomplishments, where do you see yourselves potentially going in the next couple of years, that is so critical. We have to capture that information. Because that's, at the end of the day, what will justify this program continuing in a couple of years. Because AIDD is going to have some decisions it has to make. And without those outcomes, it's going to be very difficult to be able to go to a new commissioner or a new administrator of the agency and say, we need to continue this. So how you document that, how that information is collected, how it's synthesized, and then presented back to the public, back to whoever's in the commissioner's role, back to the administrator's role, is extremely important. So not to put pressure on you. But again, going back to the beginning and seeing where everything started back in 2011 and 2012 to now, and the accomplishments that have been made in various states, it's actually been amazing. And fortunately, we're seeing it not only here, but we're also seeing it in the employment side, where I know a lot of you are double dipping and doing work on both sides. So it's great to be here. I know that we have a packed agenda. I don't want to take too much time. I told Shelley that if she wanted to open it up for a couple of questions, I'd be willing to do so, but it depends upon her timing and her schedule, because we all know that this is her show.
Very